Women who don't wear bras end up having higher breasts than women who do wear bras. But there are several factors that a woman passes through during her life. Getting pregnant, becoming a mom, breastfeeding, and obviously the weight changes that occur during these times. Certain women accept them, other women don't. As a plastic surgeon, I'm here to help whoever doesn't. Breast surgeries are one of the most common surgeries performed worldwide. They have been increasing significantly and exponentially over the last couple of years. Social media is not filtered. It's causing women to kind of have a skewed view of how they should look. I believe a good plastic surgeon and a good result should be to get the same woman how she was 10 years earlier and not just change her completely.
Do exercises actually help women lift the breast up? Hello and welcome back to the Gayu Lewis podcast. We talk a lot about what happens to a woman in midlife. We talk about hot flashes, hormones, weight gain, sleep, mood, but we don't talk nearly enough about what happens to her body. Our breasts change, our skin changes. We lose volume in places we don't want to lose it and gain it in places we don't want. And sometimes look in the mirror and think, when did that happen? And then the conversation becomes bigger. But do we accept these changes, or is it okay to get and do something about it? That's exactly the conversation we're having today. Joining me is Dr. Elias, a certified plastic and reconstructive surgeon here in Dubai with extensive experience in breast surgery, body contouring, and aesthetic procedures. And I'm really looking forward to this conversation because I think there are so many questions women have about their changing bodies but don't necessarily know how to ask and who to ask. Dr. Elias, thank you so much for joining me on this podcast today. I think this is a conversation, again, a lot of women don't really ask or want to ask or who to ask, right? Because our bodies are constantly changing and we don't know whether we are happy with these changes or we are probably cursing as why are these changes happening to us and not the men, right? So I'm very glad that you're there on this podcast. So to start from the beginning, why do women's bodies change as we age as compared to men? Men age like fine wine, but we are exactly the opposite.
So I don't necessarily agree on that, but first of all, thank you for having me. It's a pleasure to be spreading awareness. I try to spread awareness wherever I go. I am a plastic surgeon, but at the same time, I like teaching. I like people to know more. So concerning the question that you asked me, I don't think that women don't age like fine wine, to be honest, but there are several factors that a woman passes through during her life. Becoming a mom, getting pregnant, breastfeeding, and obviously the weight changes that occur during these times. And there's also the hormonal changes that a woman passes through before menopause, during and after menopause. So these play a big role in the change of the woman's body, which, to be honest with you, certain women accept them, other women don't. And as a plastic surgeon, I'm here to help whoever doesn't.
Yeah.
Right. So yeah, that's generally, these are the main reasons that make it different between men and women. But both men and women do age, and we see a lot of changes happening in both, actually.
Okay. So who are your main clients? Is it the women who come to you or is it the men?
So it's actually both. Obviously, women, they have more social pressure to look their best. And so I would say around 70 to 80% of my clients or patients are women, and around 20% are men. But recently, men are doing more of the cosmetic procedures and the surgical procedures also. I think that the taboo concerning in terms of women has been treated before that of men. So men now are opening up, and I believe, it's going to be a 50-50 at a certain point.
Okay. But when women, like you said, come earlier, was it that social media and you said societal pressures are there, that's why women come. Do you think the social media also puts a lot of pressure right now? Because of the filters that we see, people are not accepting their real faces or the way they look in general. Is that a reason that cosmetic procedures have become more popular and become a social pressure right now to be a certain way or look a certain way?
For sure. Several factors, starting with COVID, right? So we've noticed that a lot of facial procedures, non-surgical mostly, have increased significantly since COVID and since people started working from their home or over the screens or laptops. They start seeing themselves a lot on the screen, and this is what gets them to us. That's the starting phase. But then again, social media since then has boomed significantly. The issue with that is that social media is not filtered. So there's a lot of people who are not probably specialists in the field, or just everyone can give their own opinion.
Yeah.
And women specifically, they don't know which is true, which is not true, and it is not regulated to a certain degree. Earlier on, it was in magazines, people who had the specialties or who were specialized in this matter were telling or were setting the trends. Nowadays, anyone can do anything, and women tend to follow anyone. So it's this that is causing women to kind of have a skewed view of how they should look.
Yeah, like I said, I think you're very right, because I earlier did a podcast with one of the editor-in-chief. She was the editor-in-chief of Harper's Bazaar, and she said earlier we used to set the trend of what fashion was, and now social media has just taken it and trends are changing every day.
Completely agree.
Yeah, so
Completely
I think what you're saying is very similar when it comes to the aesthetics as well.
100%. Nevertheless, there are certain changes that every woman passes through, mostly after massive weight loss, pregnancy and breastfeeding, where I really and truly believe that as my specialty as a plastic surgeon, surgical procedures play a major role in making them feel more comfortable with their own bodies.
So when you said make them feel comfortable, I think I'm coming back to the same question, that when we look at our mirror, are we trying to keep ourselves happy the way we look in the mirror, or is it for somebody else to see and say, you're looking better?
So it can be either or, but my job actually is making her looking better in her own way, right? We don't want to change our personality or our look. In my practice specifically, I generally try to reverse the aging process rather than to change who the person is.
Oh, okay.
So there are certain things that we know change in certain ways. And our main aim, I believe a good plastic surgeon and a good result should be to get the same woman how she was 10 years earlier and not just change her completely.
Okay. I like that. I like how you said in terms of not aging, keeping her young, looking younger the way she used to look.
Yeah.
Do young people come and get procedures done from you, or do you actually see a lot more midlife women coming to get procedures done with their changing bodies?
It depends on the type of procedure, right? So, for example, blepharoplasties, eyelid surgeries, breast augmentations, generally it's the younger age. As for bigger surgeries such as tummy tucks, mommy makeovers, and these things, I would say it starts after the age of 35 to 40. The certain procedure is what determines the certain age, or vice versa. So, it's not, there's no, a certain age group coming more than another age group. It depends on what they want generally, but we see all age groups. Obviously, I do not operate on anyone that's less than 20, 25 years old.
Okay. Because they have no idea what they're doing to them, their body?
Exactly. And then this early on, they might end up needing redo surgeries and revision surgeries because they still have all of their life ahead of them. So.
You mentioned tummy tuck and mommy makeover, a couple of words that hit me. With the Ozempic era that is happening right now, a lot of people are losing weight. Does surgeries like this really help those people with the sagging skin in general?
So the GLP medications, the Ozempic, Mounjaro, and now the retatrutide and all of these new things, they definitely cause a lot of changes in a woman's body. Mostly in terms of massive and quick weight loss, and at the same time the loss of collagen in our skin. So this, in combination with also the muscle loss that happens with these medications, changes the body significantly. Now, does surgery help? For sure, 100%. Surgery does help. But we have to see that if this person stops these medications, are they going to gain weight again?
Yeah.
So I would say surgery definitely helps. But for these persons, in my screening process, I would tell them you have to prove to me that you're able to maintain your weight so that you can maintain the result of this surgery. So yes, we have seen this, boom in those patients that have lost a lot of weight, and it also affects a lot the face.
So the Ozempic face is true?
It is true, 100%.
Okay.
I can know if someone is taking Ozempic or not. So.
You're like, you got the scanner, you're like, yeah, this person, yes, no.
It's a blessing and a curse at the same time. So.
I remember I spoke to one of the doctors again. He was like, when people don't have the right alignment, he's like, I can just see it. So he looked at me and he's like, you got scoliosis. I said, yes. He's like, that's the, blessing and, a curse at the same time. Because
100%.
every time I see somebody, I can start spotting what issues they have.
Yeah, exactly. Unintentionally. It's just how you are. Your brain is programmed this way. So, yeah.
Doctor, talking about, midlife, and one other thing that mainly changes are women's breast, right? We used to have nice perky breasts at one time, and then with pregnancy and then breastfeeding, and then of course with estrogen going down and the skin elasticity going down, things start going down south.
Yes.
Do exercises actually help women to help lift the breast up, or those really don't work and it's only surgery or a lift that can help?
So not at all. Exercising does not help lift a woman's breast, unfortunately. Okay. What happens with time is that, and there's something quite unintuitive. So women who don't wear bras end up having higher breasts than women who do wear bras.
Oh.
Yeah. Not that I am advocating for you to wear or not to wear a bra, but the science behind it is that if you don't wear a bra, the ligaments and the tendons of the breast are always under tension.
Okay.
So they don't loosen up as much as when you wear a bra. Now, I just wanted to put that out.
I like that.
Yeah. In terms of the changes in the breast, so there's a lot of changes that happen even without pregnancy and breastfeeding. The breast loses volume, right? It changes from glandular, the gland, into more of a fatty type of breast. And the ligaments just relax and drop. Now, the changes happen mostly and more in women who have bigger breasts.
Okay.
Right. So women who have small breasts, I would say like an A or a B cup or a small B cup, don't have a lot of changes. But once the breast drops, you have to do a specific surgical procedure to correct it.
Okay.
Be it some women just lose the volume without sagginess of the breast, so you just put an implant.
Okay.
Certain women, they have both, sagginess and volume loss, so you have to do a lifting procedure and also add some volume, so that they get the nice cleavage and the upper pole fullness. So it depends on the case as to what the surgery would be, but I believe that any droopiness or sagginess or ptosis, as we call it, is not corrected with exercise, for sure.
Okay. Talking about implants, there's something that I read about implant illness or people end up having toxic reaction to implants. Can you elaborate a little bit on that?
Yes. So breast implant illness in women who have had breast implants is a certain percentage of women, not everyone. It's mostly when a woman has an implant. An implant is eventually a foreign body that you place inside the breast, right? They start having tiredness. Some of them don't feel okay. Some of them have GI issues. Some of them end up having also some skin patches and skin issues. And this happens mostly in the textured implants and in the old type of implants.
Okay.
Newer generation implants, nano-textured implants, have less risk of doing that, which is also gets me to also talk about the the specific type of tumor that old implants used to cause, which is a BIALCL, breast-induced implant lymphoma.
Okay.
So this was also with specific types of implants earlier on that were eventually recalled in the market, and women who had them, ended up removing them. And the treatment for that was just to remove the implant, same as the treatment for the breast implant illness.
Okay.
Now, also the size of the implant also plays a big role. Smaller implants have less risk of causing breast implant illness.
Okay. So, but if you want like really big boobs, you're basically going to have a little bit more of an issue, potentially.
The risks are higher, yes. The bigger the breasts, the bigger the possibility of them falling, creating a capsule. The bigger the implant, the bigger the risks, for sure.
Okay. With these implants, can you still get your mammogram done?
So 100%.
Okay. So they don't rupture, none of that when the machine is pressing you?
So there's a thing that's called the modified mammogram, where they don't put a lot of pressure. They also, they do two images. The first image, they only compress the breast tissues. The second image, they compress the breast with the implant, but slightly. So the radiologist or the person doing the mammogram for you need to know what they're doing.
Okay. So you need to communicate that, yes, I have implants. Or is it very easy to see someone and say that, yes, you have implants?
Depends on the size and the type and the procedure. So the recent breast tissue preservation, which is the MIA and the Preservé that I usually do, these procedures, if you're just a general person, you might not be able to figure out if the person has an implant. It also depends on the starting size of the breast.
Okay.
If a woman has already good breast tissue and you put a small implant, you're not going to see it, right? But a same implant in a woman who doesn't have any breast tissue, you're going to be able to see it. But in general, no implant whatsoever should affect the ability to screen for breast cancer or, do a mammography or an ultrasound.
Okay. When you mentioned this, it just came to my head. When you started off, did you have any funny requests from any clients who said, and you're like, no, that can't really happen, or you look really funny with these procedures?
Not necessarily, to be honest, because we're used to seeing a lot of, funny stuff. So before being a cosmetic or, a cosmetic surgeon or a plastic surgeon, I was a reconstructive surgeon. We used to see all sorts of things, all sorts of weird stuff getting into the emergency room during our training. So any request by a woman generally is not that, my threshold is quite high, to be honest.
Okay. Anytime that you have said no?
For sure. And I still say no. I still say no for around, I would say 20 to 30% of people, be it men or women, that I see.
Okay.
My criteria are as follows. First of all, if I really don't feel a connection with the person, I have to have a connection with the person to be able to give them my best and to be able to treat them adequately in the post-operative phase. The second thing, if the request is unnatural. The third thing is the reason why they're doing the procedure. Some women come to me, they want to do the procedure because they want to please someone else, or because they're passing through a rough patch, let's say, for example, they're getting divorced, these things. They're not in the right mindset. So I don't refuse them completely. I tell them, go think about it. And obviously, another reason is when they're medically not fit to do the surgery itself.
Okay.
Because safety is very important.
Okay. And when people do procedures, do you need to have a time difference between another procedure, or can you do multiple procedures back to back, or one after the other?
It depends. Again, in medicine, there's no black or white.
Okay.
Generally, we like to wait at least 4 to 6 months between two different procedures, but it depends on the procedure. We're talking here about big procedures. Whereas if you do, for example, let's say a big procedure such as breast, abdomen, and these things, and the patient comes to me after a month and a half to 2 months, she wants to do her eyelids only.
Okay.
The eyelids we can do under local anesthesia. She's awake, So it all depends. But in general, we would definitely like the person to be healthy between the procedures. So that all depends on the type of procedure.
Okay. And what's the procedure that's most wanted?
For me, in my practice, I am very specialized in breast surgeries. So I do a lot of breasts, be it lifting, reduction, augmentation, and we're seeing a lot. So the trend nowadays is going towards smaller breasts, enhanced, natural, but smaller. So I see a lot of breast cases in my practice. It's also believed that breast surgeries are one of the most common surgeries performed worldwide.
Okay.
And they have been increasing significantly and exponentially over the last couple of years.
Okay. So the Pamela Anderson types are not being requested anymore right now.
They're not being requested. Doctors even are not very keen on doing these types of surgeries. As I see it in my practice, the more mature I become in my practice, or the more time goes by, I become more interested in women's health, which is very important for me. And, to preserve a woman's health and give her a good result with minimal downtime and all of the, risks that should be less, it's always good to not destroy a woman's anatomy. The breast is a very, fragile structure.
Yeah.
And for us not to destroy it, we have to go more towards the natural side. So the Pamela Anderson is, and I even get a lot of patients who had bigger implants and want to get them smaller even. The trend nowadays is to get, the smallest possible with a good look.
Okay. Talking about implants, once you put them, do they stay for life, or do you need to change them after a certain period?
So the new generation implants, they tend to stay for life.
Okay.
There are lots of doctors who advocate to change them every 10 years. I don't know why, to be honest with you, but generally the implants, unless they cause an issue, the new generation implants tend to stay for life. Now, that being said, you need to do regular follow-ups and checkups. For example, every 5 to 10 years, you need to do an MRI, which is the best way to check an implant. And obviously, you have to do ultrasounds and mammograms for your breast tissue. But in general, the new generation implants don't need to be changed every 10 years. That's a myth.
You spoke about the mummy makeover. Can you elaborate what is a mummy makeover?
Sure. There's no specific definition. It is a combination of different surgeries to improve a woman's body, which generally started after pregnancy and breastfeeding and the changes that happen. So it's generally a procedure on the breast and another procedure to the rest of the body.
Okay.
So it can be a breast augmentation, but in women who have had children and breastfed, it's mostly a lift with or without an implant, combined with a tummy tuck, because after pregnancy, the muscles of the abdomen tend to separate, so we need to reattach them together.
Yeah.
And it can be also combined with some liposuction and fat transfer to certain areas of the body, mainly being the buttock area.
Okay. So people do implants for the butt as well?
People do implants, yes. I am completely against it because I have seen some horrendous results and complications from it. It's a very high risk area.
Okay.
So and the result is not the best, to be honest with you. So first of all, it's a very technical surgery to be done. The implant cannot be put under or over. It has to be inside the muscle, which makes it a lot, which makes it very technical, the procedure itself. And then this is an area that is being, I'm trying to choose my words I don't want to say abused, but it's being, subjected to a lot of pressure.
Yeah.
When you sit, when you sleep, when you exercise. So there's a lot of complications that can happen. The implant might flip, it might turn around, and a lot of these things. And the third thing is the risk of infection, because it's not a very clean area, regardless of how much you clean it. So I am against placing implants in the buttock unless we get a new procedure that is safe, such as the Mia that I do.
Yeah.
So if that happens, then I might think of doing it. For the time being, the best way is to just, put some fat there.
You mentioned about some technique. Can you tell us what Nia is?
Mia. So Mia, it's a breast enhancement procedure.
Okay.
It's a very simple procedure which we do in 15 minutes under local anesthetic. We put an implant in the breast tissue and from underneath the armpit, it's like a 2.5 centimeter incision. The person's completely awake. We do it, we place the implant in, and then she continues her daily life the same day. I've had patients, friends who come do it together and then go have lunch, continue their daily life as is, no downtime whatsoever. You go back to work the next day, it basically relies on tissue preservation. So we're not cutting into the breast tissues. And you can go back to exercising your lower body in 1 week, your upper body in 3 weeks, compared to the 3 months of the regular augmentation. So,
wow.
Yeah. Nevertheless, as we said, the implant sizes are a bit small.
Small, yeah.
If you want to go slightly bigger, there's a different one, but same concept. Yeah. But instead of going underneath the armpit, you can go from under the breast.
Okay.
Same concept, same downtime. This is mostly, as I was talking about women's health, it preserves women's health in terms of going back to your normal life immediately. Yeah. And at the same time, it preserves your breast tissues.
Okay. That's very interesting. What happens to the scar? Does it leave a scar because it's a cut, or does it fade away?
Scars, we do our best as plastic surgeons for the scar to heal properly. So in general, we shouldn't leave a lot of tension on the scar. We shouldn't manipulate the skin edges a lot while stitching. So this is the best that us as plastic surgeons we do. And we do take different types of stitches than other doctors. But scarring also is 50% a function of your own body. It's genetic. So if a person genetically is bound to scar, they will eventually scar. So what we do is we hide our scar in certain areas that don't show. But in general, if a person is to scar, they will scar.
During the mummy makeover, you mentioned about getting the pelvic floor. So do people who have diastasis recti, they come to you for this surgery?
Yes. Diastasis recti is different than the pelvic floor, obviously.
Yeah. I mean,
people with diastasis recti, they generally come to plastic surgeons for the correction.
Okay.
And it's done if there's not a lot of skin, we don't do a full abdominoplasty. We just go from where the C-section is generally, slightly higher. And we go all the way up, stitch the muscle, and then close it up.
With the mesh, I heard there's a mesh some people put to get the muscles together.
You don't need the mesh.
Okay.
You don't need the mesh. You can just take several layers of stitching, and that's good enough. The mesh is used when a person has a hernia.
Okay.
So this is when you put a mesh. It can be combined with the diastasis recti correction also.
Okay. But imagine after my first pregnancy, I had diastasis recti, and then we did the surgery. Can I still, have my second child? Would the separation be bigger?
So you can still, after an abdominoplasty with the correction of the diastasis, you can still get pregnant. It will not affect pregnancy.
Okay.
But the pregnancy obviously will affect the result of the abdominoplasty. Yeah. Now, the diastasis recti, will it get bigger? It should not. Unless, let's say, for example, the first time you had one baby, the second time it was a bigger pregnancy, you had more twins, you had twins, let's say. So the bigger the abdomen grows during pregnancy, the higher the risk of it going further out. So it doesn't mean that the second pregnancy there would be a bigger diastasis. It's not related whatsoever.
And you can do an abdominoplasty after the second one as well, or is the surgery only once?
No, you can do it after the second one, but in general, if you do it the first time, this means that all of the skin has come off. Like we remove all of the extra skin. Yeah. So the second time would be more of a diastasis recti repair than a full abdominoplasty.
Okay.
Because you will not gain as much skin as the first time, because most of it is already, tightened up.
Very interesting to understand. The reason I asked about this is because I had diastasis recti.
Yes.
That's why I said, there were some questions that, but I worked towards with an exercise program to actually help.
100%. It improves.
Yeah.
It improves by 80%. And the very important thing is to exercise while you're still pregnant, also to keep the muscles, strong and tight. It also helps you with the recovery down the line after delivery.
Yeah.
It doesn't return to 100%. There would still be a small amount of recti, which is insignificant in certain women and doesn't require any procedure.
Yeah. So I just did it's a pelvic floor and plus a diastasis recti workout. And then if there's a gap there is probably a minuscule gap, but then it doesn't really trouble me that much.
Exactly.
Yeah.
Exactly.
Coming to women in midlife again, perimenopause, menopause. Most of the women end up taking hormone replacement therapy. When you're taking hormone replacement therapy, does any of the aesthetic procedures, is there any contraindication in terms of what you can do, what you cannot do, or there is no issues at all?
There is no issues whatsoever. But in general, I would prefer for this HRT to be stopped for, I would say, like a week before the procedure, because certain medications tend to increase the risk of blood clotting, and they might cause, DVTs and certain blood clots. So it's just preparation for the procedure. But in general, HRT is not a contraindication to do any procedure whatsoever. What is a contraindication, obviously, is if you're taking any blood thinners. So again, you have to stop them a week before. Otherwise, we're good to go.
Okay. So anybody wanting to do any procedures, making sure that the medications is something that you watch out for.
Yes.
Rest, anyone and everyone can get a procedure done.
If medically fit, for sure. Like if they have cardiac conditions, if they cannot stop blood thinners, it depends on the general condition. But in general, anyone can do it.
Okay. And what would your advice be for women, in their 40s and 50s? Any procedure which you feel that they should consider with their changing bodies?
So what I tell all my patients is that there is no specific procedure for any specific person. What you should prioritize is your health to start with. Make sure that you have a healthy lifestyle, that you are doing your best, exercising, eating well, doing whatever you can. And once you're at that point, whatever is bothering you can be corrected.
Yeah.
And what I also tell my patients is that once you do the surgery, you cannot let loose. So as doctors, we do 50% of whatever is done.
Yeah.
And the other 50% is up to you to maintain.
Okay.
So if you're, let's say, do liposuction, and after the liposuction end up, just eating whatever and not being healthy and not exercising, you're going to gain the weight. So any procedure that's done, as I said, there's no specific procedure for anyone. It depends on the case. But whatever you do, you should be able to maintain this result. If you don't, then everything, you'll probably have to
go back to the same cycle in general. Is any of these procedures, are they only for the rich, or can normal people also afford them?
It depends. Right. So, but I would say it's not about the money. Obviously, certain places, doctors, clinics, they tend to overcharge a lot. Okay. It's up to the doctor there's no specific price for each procedure. It depends on, how much the doctor values their time and the expertise of the doctor, obviously. What I would say, I would kind of flip the question. I would tell these people, don't let the financial aspect guide your decision on your doctor. If you don't have the money for the time being, wait on it, save on it. If you're convinced with your doctor, we can always get to a middle ground. But don't choose someone just because the price is cheap.
Yeah.
Because eventually, and I've seen it a lot, you get what you pay for. Some people that I see travel to other countries. I'm not gonna say.
Yeah.
They do their procedure because it's 1/5 or 1/10 of the price here. And then they come back crying because their doctors are not following up on them. They had a certain complication. And generally it's like, just, these doctors who are cheap or who don't charge a lot, they work on numbers. So they do a lot of cases. So they end up not being able to follow their patients. So, as I said, you get what you pay for.
Yeah.
Obviously, the very high charges also are ridiculous. But, somewhere in between, average price range should be okay.
What does the price range look like, if you're comfortable to answer?
For what procedure? That's the thing. So you can start from, I don't know, maybe, for breast, you mean?
Yeah.
Breast, Between 30 to 40 to 50, depending if it's an 1,000 dirhams. I'm saying. If it's an augmentation alone, augmentation with a lift, if it's a redo, if it's been done before, depends on the amount of work that's done. That's average, I would say. Some people charge 100, some people charge 20, 25.
Is there any specific nationality that actually comes to you for their procedures, or you see a mix of everyone?
It's a mix, but certain nationalities are more than others. Obviously, being Lebanese, I see a lot of Middle Eastern people. I see a lot of, North African, Arabic-speaking people. I speak French also, so I get a lot of French patients. And having trained in the UK, and worked in the UK, I have a lot of British nationals who come to me. But my main practice relies, again, mostly on expats. So Lebanese, Europeans, British. I do have quite a bit of the local population, but my practice relies mostly on expats because I'm more comfortable speaking in English and advertising in English and doing my educational videos in English. So this is why.
Okay. Interesting. I had to ask you this question. You said that when you look at anybody, you come to know if they've had a procedure or not. Any particular celebrity that you see and you actually like the work that they have done, especially women?
That's a tough one. So you're asking me about a celebrity that
you feel has done any aesthetics jobs on their face or the overall body, and you feel that it's a good job done?
To be honest, I don't focus a lot on these things. I'll be very honest with you. In general, I can tell you a couple. I probably shouldn't, but I can, talk more about the celebrities that I don't like.
Okay.
But I'm not going to do that.
I mean, maybe
we're going to get into trouble there. But in general, the celebrities that, I like are just the ones who have done something very minimal.
Yeah.
I would say Botox, bit of fillers, in a very natural way. Very rarely that we see celebrities nowadays doing a lot of body surgeries or procedures. They tend to go more the natural way, such as J-Lo, Beyonce, these people, they all have done stuff, but they still look natural.
Yeah.
So here are a couple of names. Yeah.
Doctor, it was a fantastic conversation. Now coming to a very segment called the Hot Seat Cold Truths. Yeah.
Okay.
So rapid fire style question.
Fair enough.
Yeah. Whatever comes to your mind. One procedure you would never recommend.
Butt implants.
What's the most overrated aesthetic procedure right now?
Most overrated aesthetic procedure. Thread lifts.
Thread lift?
Yes.
What's
for
that?
The face. Threads in the face.
Very interesting. Okay, breast implants, are they going out of fashion?
Never.
Yeah. But you said the smaller is there, the bigger ones are now kind of...
Yeah, trends change, but nowadays, the trend is more towards the natural.
Okay. Can you actually tell when someone has had a good plastic surgery?
Yes.
What's the biggest lie the aesthetics industry sells women?
That one procedure can change your life.
Yeah. So
we're talking about aesthetics, right?
Yeah.
Because, women that you see and they tell you that I just did one thing, that's a lie. Okay, so most women that, have this glass skin and they really look nice, they do everything, they do procedures on a regular basis and then they follow up with creams, and it's not easy. It's not easy. You have to put effort into it.
Okay. Would you ever tell a woman you don't need anything done?
Yes.
Should there be an age limit for cosmetic surgery?
Yes. Obviously, less than 20, these things, you shouldn't be doing it. And women who are more than a certain age with medical issues, obviously.
Okay. Instagram filters, are they creating future plastic surgery patients?
Yes.
If your wife wanted a procedure you thought she didn't need, would you do it?
No.
One celebrity aesthetic trend you wish would disappear?
Yeah, just telling people that, not washing your face would help, or, using certain stuff that doesn't help actually helps.
Yeah, okay.
Which some celebrities are doing.
Okay. Age gracefully or fight aging, which one would you choose?
Age gracefully.
Okay. Thank you. Very cool answers. Now it brings me to the last segment of my podcast. It's called the 1%.
Okay.
Because 99% of my podcast is all about women wellness. But men are a part of our lives too. So this 1% is dedicated to them. So what would your 1% advice be to the men in our lives? What can men do better to support women?
I would say not put a lot of pressure on women, accept women how they are, give women their choice on how they want to be.
Yeah.
Example, don't tell a woman that she needs to look a certain way. And obviously support women and just be with them. You know, there's a saying that says, you know, behind every successful man is a great woman. Yeah. I think it should be the other way around.
Yeah. And would you say increase the budget or keep money for the implants in general, for any aesthetic procedures?
Yes, for sure. If they want to do it, why not? Why not? As long as the reason is the right reason and as long as the expectations are the right expectations.
Brilliant. Thank you so much, Doctor.
Pleasure.
Any parting advice for the women listening? What would you want to leave them with?
So I would like to tell them not to focus a lot on trends. Trends come and go. And to focus more on their own self and their own image of how they want to be. I would also like to tell them that, you know, every woman is unique. Every woman is different. So don't try to look like anyone else. Just, if you want improvement, improve on your own self. And that's the best way and the most beautiful way of doing it.
Oh, that's so well said. Thank you. That's some amazing, words that you spoke. And Doctor, where can our listeners connect with you?
So I have my Instagram account, and I actually answer personally, as you already know. Yeah. I don't have anyone dealing with my accounts. And if they would like, I am at Highness Clinics, Healthcare City. So if they'd like an appointment or anything, I'd be more than happy to see them.
Brilliant. Thank you so much, Doctor. It was fantastic having this conversation with you. Like I said, I think I have a little bit more information of what goes behind the whole aesthetic side. Probably 1% is what I learned today. A long way to go. But thank you so much for joining me on this podcast.
I appreciate it. Thank you for having me. It was a pleasure.
I hope this conversation has helped answer some of those questions you don't always ask out loud, especially around how our bodies change as we get older and what's actually normal and what our options really are. If there's anything we haven't covered, leave your questions in the comments. Dr. Elias and I would be happy to answer them for you. And as always, if you found the conversation useful, share this podcast with another woman who might need to hear it. I'm Gayu Lewis, and until next time, menopause, why pause? Let's play.